Welcome to my channel once again. Today we are going to look at some few notes we can keep for our nursing exam under insulin therapy. So previously we know that insulin is a hormone released by the beta cells which are within the islets of Langerhans in the pancreas that actually helps in regulation of blood glucose or blood sugar. So therefore, in a situation where the individual has problem with glucose regulation, which is in diabetes, the person will require an insulin therapy, especially in type 1 diabetes and sometimes type 2 diabetes where oral medications are not effective. So let's go on with the facts you need to keep for examination. But here are some few introduction before we get to those points. So normal routes of administration of insulin is subcutaneous, which is the most common one, and then we have intravenous, which is usually used in emergency situations, then intramuscular, which is rarely used, technically rarely used, but mostly subcutaneous at an angle of 45 degrees is used. Then we have intravenous, where we go into the vein, where the 90 degrees intramuscular is rarely used. Alright, before we continue with the sites of insulin injection, there are more things we have to focus on: the angle of delivery, where sometimes there are other means of injection where we use the insulin injection pen, which also goes at an angle of 90 degrees, but the size of the needle matters. So it delivers it into the subcutaneous part even though it's going at an angle of 90 degrees, right? And then sometimes injection is even based on the size of the muscle itself. So technically, person's arm is more not thin at an angle of 45 it goes, but person with that kind of fat around its site of administration could also go for a 90 degrees despite it not being going into the muscle, where we all know that 90 degrees back in school is intramuscular, right? So let's look at the sites of insulin injection, where we have the abdomen, which is referred as the fastest, the thigh, the upper arm, and then the buttocks as well. So one thing to know for examination is that during administration of insulin, you have to rotate the site of injection. You can't keep injecting one site in order to prevent lipodystrophy. That is one of the things to keep for examination. It's a complication of insulin injection where you have to actually rotate the site of injection to prevent this phenomenon. And at this point, we have to focus our lens at this chapter because this is where most of the questions comes out for examination purpose. So complication of insulin therapy, where we have hypoglycemia being the most common complication. Keep that for examination. So the signs are sweating, tremors, confusion, and dizziness. So the management is just specifically to start giving glucose at that point in time and then quickly monitor the blood sugar to be sure that it's hypoglycemia at a point in time. So you give oral glucose or IV, that's 50% dextrose bolus, depending on the severity of the state at that point in time. So imagine a patient is actually out there moving casually and then having these signs and symptoms, and it's not that severe. The patient have a simple carbs in his pocket, could also take that, something like fruit juice and then simple sugar as well would do. But in a more severe situation where in the hospital we have to give more like 50% dextrose bolus to actually solve this problem. On our second list, we have the lipodystrophy, which we discussed earlier that this had to be prevented by rotating the injection site, right? It's an abnormal fat distribution at the injection site because there's failure to rotate the injection site. So cardinal thing you have to do here is that you rotate the injection site to prevent this abnormality. Then the last one, we have allergic reactions, which are actually rare. So it comes out with redness, swelling, and then itching at injection sites. So usually determined as an allergic reaction. Antihistamine are given, and other options of insulin is also kind of selected in order to actually give the patient to prevent this phenomenon.